Hello everyone, my name is Dr. Preeti Raheja. I'm a consultant gynecologist with Bliss Hospital. Today I'll be talking about do's and don'ts during pregnancy. The news of pregnancy brings immense joy to a female, but along with that comes lots of apprehensions as to what she should do and what she should avoid. The most common apprehension is regarding the food, because lots of things, the outcome of the baby depends on what food she is consuming. We advise the patient to consume rainbow food. By rainbow we mean that she should consume lots of seasonal fruits and vegetables, foods which are organic and devoid of pesticides. We advise patients to consume lot of nuts like almonds and walnuts, which are rich in omega-3 fatty acids, which are good for her and also for the neurological development of the baby. If a patient is advised, if she is a non-vegetarian, she can continue eating non-vegetarian food, but she has to be very careful regarding few foods such as raw meat, like sausages and salamis, which we call as deli meat. Fish is it's a very good source of proteins to a patient, but we advise the patient to consume more of freshwater fish rather than seawater fish, because seawater fish can contains high amount of heavy metals. That is the reason we tell them to avoid such foods. We tell the patient not to eat for two people. She has to keep her portions divided. So most of the times we tell the patient that she should have small frequent meals. The purpose for that is that it will keep the metabolism of the body, it will balance the metabolism, it will provide an optimum level of glucose to the baby, and also during pregnancy most of the patients would observe that if they keep fasting for very long and if they have a plate full of food in front of them, they are unable to eat. They have a lot of nausea regarding when they see that amount of food. We advise the patient to avoid eating cold food from outside. Any food which is hot and moving from a moving place, she can very well eat, as far as the hygiene point of view is taken care of. Next comes their concern about the exercise. We tell the patient to avoid hot water baths and rigorous massages of any part of the body. We don't introduce a new exercise to the patient during pregnancy. If a patient is accustomed to do a particular kind of exercise, she can continue under guidance of an expert. The safest thing to do is a brisk walk according that will be advised by the doctor, and yoga under an expert. Those are the safest exercises which any pregnant female can do. I would advise that all the patients should visit their doctors at a regular interval and take the medicines regularly as advised by the doctor. The most important take-home message is keep yourself happy, think positive, and believe me, it will have a lot of impact on your child. Thank you so much.